So I do apologize for the switch up. Elizabeth will be joining us here in a few moments to continue the meeting. But I did want to go ahead and get started for everyone who has joined us so we can stay on schedule for the agenda. For those of you who are new, we're going to go over a little bit about the purpose and the objectives of this network, as well as this meeting will be recorded for those of you who would like to see this recording later on. So the mission of the North Carolina Latino Health Alliance is to increase positive health outcomes in the Latino community across North Carolina. It's done by improving organizations and communication efforts among alliance members. It has four main objectives. The first one is to advocate for better access to health services. Secondly, to identify obstacles of inequity within the healthcare system. Third is to strengthen collaborative relationships to meet the needs of the Latino community in North Carolina, and especially in rural areas. And then lastly, to improve education outcomes so that we're able to increase Latino student participation in healthcare workforce. Next, we're going to go over who's on the call just so we get an idea of everyone that's on. So that gives the speaker a little bit more information as well. So I'm going to go down our list. If you could please state the name of your organization and agency, your name and title, and how you heard about this meeting, and if you have any upcoming events that you'd like to share with us. So I'll start off with Allison Bettis. Good morning, Allison. We'll move on next to Ann Fields. Good morning, Ann. Oh, we can you can go ahead, Allison.
Sorry, trying to get my microphone to work. My name is Allison. I am program specialist here at Durham County Health Department, and I heard of this meeting through kind of a group chat support.
Thank you for
Think
joining us this morning. Do you have any upcoming events that you'd like to share with us?
so with my program specially, it specifically it's with HIV and STD testing. And as of the moment, we kind of have closed all outreach testing for now, especially in the Latin community because of everything that's happening. But people are welcome to come down to the health department and get tested and hear more about the programs we have there.
Thank you for joining us this morning. And thank you for sharing that as well. If you want to input some information in the chat box, you're more than welcome to as well. So next we'll go on to, sorry, Cecilia Hernandez. Good morning. And I see. Okay, I hit ask to unmute. Hopefully that helped. We can't hear, but we do see you.
Okay.
There we go.
Okay, I can see you now, but I cannot see you. But I was trying to. Can you hear me?
We can hear you.
Okay, I'm Cesar Hernandez. I work at Lucy Daniels Center in Secure Path program. I'm a clinician there. I work with the Hispanic community population. I'm a home visitor. I also have my private practice because I'm a doctor in psychology. And well, I'm here. I knew about this meeting through Francisco Guzman, and that's how I enjoyed this meeting today. Thank you for having me here.
Thank you for joining us, and thank you, Francisco, for that connection. Do you have any upcoming events or things that you'd like to share from your organization?
Well, right now, no, we are involved in the what happening with the Latino population right now.
Thank,
There's mhm.
thank you for joining us as
Thank you
well.
so much for
Thank you.
us.
Next, I have Ana Velasquez.
Hey, I'm in Durham, North Carolina. I assist with two groups, Foro de Padres y Juntos por una Educación. So I'm a blind family advocate in the community.
Thank you for joining us this morning. Next, I have, sorry, Elsa Huerta. Good morning, Elsa.
Hi, I tried to put my camera on. I'm in the phone, but I don't know where is the camera. This is small screen.
There
Okay,
we go.
I hear. There you go. So, hi, good morning, everybody. So, I am Elsa Huerta, CHW Academic Coordinator at El Centro Hispano here in Durham. We have three different offices. One is in Durham, the other is in Raleigh, and the last one is Scarborough Chapel Hill. And I heard about this meeting for Francisco Guzman.
Thank you for joining us this morning. Next, I have Francisco. Good morning, Francisco.
Hola, buenos días. Good morning, everybody. I'm Francisco Guzman from the North Carolina Department of Health and Human Services. And two announcements. The first one is I'm going to put it in the chat. Tomorrow we have a virtual meeting because November is Diabetes Awareness Month. And we have a person who is going to talk about diabetes and how to support the community. Of course, we have a diabetes program at NCDHHS as well that we are supporting. And second, just to make sure that everybody is aware that SNAP is, of course, reactivated since Friday with a full stamps that it's supposed that everybody who are SNAP eligible, they were getting the money on last Friday. If you have any question, let me know. I have my email. I'm going to reboot it again. Thank you, Marlene.
Thank you, Francisco, for joining us and sharing that information. Next, I have Grace Leon. Good morning.
Hi, good morning, everyone. Sorry, I can't get on camera right now, but my name is Grace Del Lozano. I'm a research assistant with the University of North Carolina, working on the age-based genomic screening project. My goal is really to increase genomic health literacy and genomic testing awareness in the Spanish-speaking community. And I'm working hard with my team to get these materials curated and translated to disseminate into the community. For anybody who's interested and would like to collaborate, I am open. And I heard about this meeting through your newsletter, but also by connecting with Elizabeth.
Thank you, and thank you for joining us this morning. Next, I have Kathy Garcia. Good morning, Kathy.
Good morning, everyone. I'm the breastfeeding peer counselor in the Warren County Health Department. And who told me about it was the director of the health department.
Thank you for joining us this morning. Next, I have Jennifer. Good morning, Jennifer. There, yep, sorry.
Hey, I'm Jennifer Giordano. I'm the outreach coordinator for ECU Health Cancer Care here in Greenville. We still have our monthly free mammogram clinic, and we are still having that. And our next one is on December the 2nd. So we're excited about continuing that throughout next year as well. And I heard about this meeting because I get the emails, and my friend Macy Mcfarland with Screening Saves Lives is presenting this morning. So we have a great partnership. So I'm excited to be here to support her.
Thank you for joining us, Ms. Jennifer. Next, I have Lisbeth. Good morning, Lisbeth. We can move on next to Madison. Good morning, Madison.
Good morning. I am Madison Freeman, and I am actually Jennifer's intern here at ECU Health's Cancer Service. And how did I hear about this meeting? Same way Miss Jennifer's. We get the emails, so she put me in on this meeting as well.
Thank you for joining us, and I hope you're enjoying your internship. I know you guys are doing great things.
Yes.
Next, I have Marianne. Good morning, Marianne.
Good morning. I'm Mary Enchanti Carol, assistant professor here at Duke University, and I organized the North Carolina Registry for Brain Health. So I don't have any announcements, but if anyone wants to join, please go ahead and click on the link and share our information, ncbrainhealth.org.
And how did I hear about this? I always get the email, so thank you.
Thank you for joining us this morning. Next, I have Pamela Rodriguez. Good morning, Pamela.
Good morning. I work at the Department of Health and Human Services under the Division of Mental Health, Developmental Disabilities, and Substance Use. I know about this meeting because my supervisor sent me the emails. And yeah, and thank you so much for everything what you are doing. I'm happy to be here.
Thank you for joining us this morning, Pamela. Next, I have Sharon Munoz. Good morning, Sharon.
Hola, buenos días. Good morning. Sharon Munoz from Hispanic Legacy Network, LLC. And we inspire, empower, and connect communities and businesses to extend their own legacy. And I here, because of the newsletters, I have a private WhatsApp chat where we always share resources for the community, and Mcfarland is one of the resources that we always share. And that's the most powerful part of our work, is bringing organizations together to create a collective impact that transform lives and strengthen businesses and build more resilient communities. Thank you for having us, Madeleine.
Thank you for joining us, Sharon. It's a pleasure to see you. Next, I have Sutton. Good morning, Sutton. Let's see.
Hi, I'm Sutton Salinger. I work with the UNC Alzheimer's Disease Research Center. I heard about this organization from Marianne, and no current events to announce.
Yeah. Thank you for joining us this morning, Sutton. And then lastly, I have Zulma. Good morning, Zulma. If not, I will pass it over to you, Elizabeth.
Thank you, Marlene, for helping me. Good morning, everyone. Thank you for joining in this morning. My name is Elizabeth Kramer. I'm co-executive director here at Mcfarland. It's a pleasure to be able to see everyone on this call today. I know it is Thanksgiving week, so I really appreciate you taking the time to join in today. I know most of you probably have busy schedules. So to continue on, I would like to present our guest speaker, Macy Mcfarland. So a little bit about Macy. She joined the Lung Cancer Initiative in 2025 as a program manager, bringing a strong passion for partnership building and collaboration, and a belief that meaningful change happens through strong connections. She leads the Screening Saves program, working to increase awareness of lung screening resources and advance early detection efforts across North Carolina and beyond. Born and raised in Oklahoma, Macy earned both her bachelor's degree and master's of public health from Oklahoma State University and is a certified state health education specialist. Macy will be presenting on the Screening Saves program, covering what lung screening is, why it's vital, lung cancer disparities, and key risk factors for lung cancer. A little bit about the Lung Cancer Initiative is a leader nonprofit with the mission to advance survivorship and provide support to those affected by lung cancer and through research, education, and access programs. To date, the organization has funded more than $3.8 million in lung cancer research and has assisted thousands of patients in accessing treatment and meeting their basic needs after lung cancer diagnosis. With that, I am glad to pass it over to Macy to start her presentation.
Hi, good morning, Elizabeth. Thank you so much for that introduction. It always feels a little bit silly when someone is talking about you, and you're like, yes, that is me. But it's so nice to have the opportunity to present to this group and to be invited. I learned about this group actually through an ambassador of ours who lives in Greenville, and I believe she had connected with Elizabeth to promote a 5K of ours. And she had recommended this group and mentioned that this would be a wonderful resource for us as we work to educate and address on disparities in lung cancer and screening resources. Like Miss Jennifer Giordano mentioned, ECU Health is a big partner for us, and I'll touch on that here in a little bit. Can you all see my screen?
Yes.
Perfect. Thank you. I will get started. So yes, like Miss Elizabeth said, my name is Macy Mcfarland, and I'm the program manager here at the Lung Cancer Initiative for the Lung Screening Saves Lives program. A bit more in detail about the Lung Cancer Initiative. Our mission is to advance survivorship and provide support to those affected by lung cancer through research, education, and access programs. We fund research grants for early career investigators and innovative projects. And like Miss Elizabeth mentioned in my bio, we have funded, it is now 3.9 million, which is exciting. We support patients through access programs such as gas cards, emergency funds, and community grants. We provide education and resources for patients, caregivers, and healthcare professionals. We help raise awareness and build community through events and outreach. And we advocate for improved screening, early detection, and access to care. And my program really does focus on the early detection and screening side. So I will touch on that and how that looks for the Latino population. I wanted to discuss a bit more in depth our gas card program. So this program is specifically for individuals who have had a lung cancer diagnosis, but we provide gas cards to support lung cancer patients traveling for treatment, and that includes clinical trials. We aim to reduce financial barriers so patients can access the appropriate care. The eligibility requirements are a North Carolina resident and currently undergoing lung cancer treatment. The application process, the form must be completed, which can be found on our website, and I will show you that later in my presentation, and just signed by both the patient and the healthcare facility.
Macy, before you continue, is there any way you could make your screen full screen?
Yes, I apologize. Thank you. Give me 1 second and let's play with this. Oh, that's not what I wanted. If you don't mind, I'm going to stop sharing so I can do it. Forgive me for the delay.
You're fine. And if not, it's okay. We could still see it. It's just we also saw like your search bar and stuff. So I just
Oh,
wanted
gotcha.
to make it just
No, you're just fine. Okay. Let's try this. Is that better?
Yes.
Perfect. Okay. Thank you so much. Okay, so I want to touch on what a lung screening is. So a lung screening is a quick, painless scan. It's a low-dose CT, which is that CAT scan. It's a low dose of radiation that for those who qualify and meet the risk factors for lung cancer and lung screening, they find that the low dose of radiation is the pros outweigh the cons. So it is worth that risk for those who do qualify. This scan looks for any spots or changes in the lungs. It's not surgery or anything scary. It's like a fancy x-ray. And the criteria for lung screening currently is 50 to 80 years old, a smoking history of 20 pack years. So pack years is number of packs per day and years smoked. So for example, 1 pack a day for 20 years would be 20 pack years, or 2 packs a day for 15 years would be 30 pack years. 2 packs a day for 10 years would be 20 pack years. So it's packs per day times years smoked. And it can be kind of a rough estimate for the most part, but they do ask for a significant smoking history. Also, either a current smoker or has quit within the last 15 years. So, why screening matters? Lung cancer is the leading cause of cancer death in the US. It is often diagnosed at advanced stages, such as stage 3, stage 4, after that cancer has spread beyond the lungs, due to a lack of symptoms. There typically are not symptoms for lung cancer until that stage 3 or stage 4. Early detection increases survival. So the 5-year survival rate for lung cancer, when found early, is 63% compared to 7% when found at late stages. In North Carolina, only 19.2% of those at high risk are screened in 2025. So 80% of individuals who reach that criteria are not being screened. Also, lung cancer takes as many lives as colon, breast, and prostate cancers. So I wanted to talk specifically about how lung cancer affects the Latino population. So in 2025, 23.4% of lung cancer cases among Latino individuals in North Carolina are diagnosed at an early stage. So what that means is there's 75% of those cases that were found at late stage. So that's why screening is so vital. 15.8% of Latino individuals with lung cancer in North Carolina did not receive treatment. So that's someone who received a diagnosis and then did not receive treatment. That could be due to a variety of reasons. And then, despite the importance of clinical trials in advancing lung cancer research, Hispanic individuals represent only about 1% of clinical trial participants. And we know that representation in clinical trials is vital to the success of a clinical trial and the accuracy of the research. So it is important that we encourage those Latino individuals who do have a diagnosis to access care, and then also, if a clinical trial is the right fit, to advocate for research and educate them on the success or the pros of that. So, Screening Saves program, I want to talk about what the program is. This is a statewide initiative led by the Lung Cancer Initiative to increase lung cancer screening rates and reduce mortality by supporting both providers and patients across North Carolina. We do this by expanding access to lung screenings, by collecting data and focusing on quality improvement, by engaging the community, and by educating healthcare providers. The program was officially launched in 2024. This is when our Navigator network was activated. We have a strong and active network of nurse navigators who do a lot of the care and help guiding patients from the screening if they experience a diagnosis, and then connecting them to resources beyond that. The program was developed and founded from feedback gathered from physicians, nurse navigators, and healthcare leaders through focus groups and surveys. This past year, our pilot program with ECU Health was launched, and Miss Jennifer Giordano and her intern Maddie have been an integral part of that. And also, they have an advising provider who helps us with provider education for the ECU Health system. We've hosted multiple provider education events to discuss with healthcare providers the vitality of screening. We activated our Early Detection Advisory Committee, which is a group of leaders, physicians who have experience with early detection in lung screening and kind of help advise our program. We focus on provider engagement, especially through those provider luncheons. We have presented and exhibited at multiple conferences. And we, this past year, revitalized our digital platform and focused on increasing our reach through our website development and social media, which I will touch on a bit here in a little bit. So, something that we are really proud of is the growth that we have experienced this year. So, in 2025, we have distributed over 1,000 educational materials, which I will show you on the next slide. Really, our focus is what we call the risk assessment tool. It is a quick handout that runs through the qualifications for lung screening. Our idea is that we hand that to someone and they can walk through and say, am I eligible for lung screening? Should I be screened? Or is someone that I love eligible for lung screening? How can I connect them to lung screening as well? So we have distributed over 1,000. We have visited 13 counties. That's kind of a rough count. I'm guessing it might be 15 or so, or locations. We've hosted 7 provider education sessions. We have reached 111 providers, healthcare providers. We've held 6 navigator meetings. We have engaged with 286 total navigators. And this is one that we, like I mentioned, are really proud of, but we have engaged with over 17,000 individuals on social media. So, what that means is through our social media, we run promoted advertisements that include education or resources for lung screening. And over 17,000 individuals have engaged. So that doesn't mean that they just saw it. That means that they clicked on it, that they sat and looked at it for a period of time, or that they liked, commented, or shared. So from this group, and I will kind of ask for more here in a little bit, but how you can help connecting community members to our materials and resources, those that you know would qualify, or those that have been affected by lung cancer, or have a family member who has been affected by lung cancer, point them to us, connect them to our resources. Connect your local healthcare providers, inform them of the Screening Saves program and the importance of lung screening. Connect with us on social media. I will share our social medias at the end, but connect with us on social media and share. We host events all over the state. So connect with us, come to our events, or share the events with anyone who might be interested. Those events look like 5Ks, community education events, or a variety of other things as well. And share our risk assessment tools. Something that I'm very excited about is that we have had our risk assessment tool translated into Spanish so that we can connect with the Latino population and the Hispanic speaking population. We know that that is important. And like I mentioned, those statistics and the disparities that exist, we think this is just one step to reaching the population and addressing those disparities. So I want to show you all that. So this is the risk assessment tool translated into Spanish. We are very excited about this. We officially had this done at the end of October, and we got to begin distributing this at a food bank of Central and Eastern North Carolina pop-up market in Columbus County. And we did interact with Spanish-speaking community members, and we're able to give them this, which is really exciting. While we know this is kind of step one, we know that there's more work to be done as well. And I would like to kind of have a conversation about that. These are our social media pages. So this is our Facebook here on the left, and this is our Instagram here on the right. So I encourage you to follow us on social media, to connect with us and keep up with what we're doing, and also reach out if you have questions, and I'll share my contact information at the end. I'm going to hold here for a second. And then this is our web page, the Screening Saves page that has kind of a great basis of information. And I will play this quick screen recording to show. So that is a quick overview of our screening page. If you go to www.screeningSavesLives.org, that is what will come up. And it walks through that risk assessment tool and then provides related resources. Something I did want to bring up that I realized that I did not mention, and I should have, but with our pilot program with ECU Health this past year, we have focused on Eastern North Carolina and especially the rural areas. We serve the entire state and are always looking for partners and to connect with different providers. So this past year, we got to focus on Eastern North Carolina and really kind of grow our network there. And then we're really hopeful to continue to do that work in Eastern North Carolina with ECU Health and then grow beyond, grow throughout the entire state as well. I did that. So with that, I would love to open it up for a discussion. And with that, how I will kind of kick us off. We know that these disparities exist in the Hispanic population with lung cancer, and we would really like to better serve the Hispanic population. And I would love to hear thoughts as I kind of went through our materials. I would love to hear any thoughts or ideas that you all might have. I'd love to take feedback. And then also, I will take any questions as well.
There is a question in the chat box, Macy.
Yes.
Starting off
Okay.
from
Thank you so much.
Shania. It says, is this just for smoker or that were smoker patients? What about the patients that have low-grade destructive metastatic cancer?
Sharon, are you referring specifically to a lung cancer? So our organization serves anyone with a diagnosis of lung cancer, smoker, non-smoker, doesn't matter. So the lung cancer serves all of the anyone with a lung cancer diagnosis. The Screening Saves program abides by the U.S. Preventative Task Force guidelines for lung screening, which for lung screening, it does outline that there does have to be a significant smoking history. So, if that makes sense. So I'm curious when you ask about what about the patients that have low-grade destructive metastatic cancer, are you referring specifically to a lung cancer or a metastatic lung cancer or a different type of cancer?
So I'm gonna speak about myself. I have a disease, a lung disease since March 10, 2011. It's called lymphangiomatosis. It's a progressive lung disease and affects women caused by abnormal smooth muscle-like cells that destruct the lungs, the airways, and lymph and blood vessels. So they are affecting and destructing the lungs. I never smoke, but most women smoke, and it's considered at some point metastatic. That's what the doctors told me. Even that I never smoke, it will become because it's growing every year. So they said that it's a low-grade destructive metastatic cancer. At some point will be. Right now it's not, but because I have the diagnosis of lymphangiomatosis, it is, but not today for me. I don't have cancer, but it will be because I already have that. Because it's multiplying, it's growing. It's a lot of holes in my lungs. So I don't know if that makes sense. I never smoked in my life. My mom did, but because she did, it transmitted it to me.
Mm.
And because a lot of people smoke around me when I was a child, when I was a little girl, that affected me. So it's like secondhand. Uh, who knew I was a lucky one to get this disease, but right now I'm not, it's not the cancer diagnosis, but I will be when I get the, hopefully never, but when I have worse symptoms.
Well, I am so sorry to hear that. And I'm grateful that you have great providers that are educating and advocating for you. I will say something that we really like to focus on, and anyone with lungs can get lung cancer. So while exposure to environmental risk, that can be radon, that can be asbestos, it might be secondhand smoke, can increase that risk. Anyone with lungs can get lung cancer. And then those who do have a significant smoking history are at a higher risk. We would, I think, dependent on if you do, and I hope that you do not, and I hope that the disease does not grow or spread. But if you do eventually have a lung cancer diagnosis, then we absolutely would support and serve you the Lung Cancer Initiative. So I hope that makes sense. But I would be happy to share any education that you might want or information on lung cancer. I'd love to share that with you.
All right, thank you. But the question was, it is just for people that smoke, are smoking, or...
So are you asking specifically about lung screening?
Yes.
So yes, ma'am. So as of right now, a low-dose CT, a lung screening, typically only individuals with a significant smoking history are eligible. And what that means is like insurance would cover it. There's actually a law going through legislation right now that Medicaid will cover it. Hopefully, we're going to hope that that passes. But so currently, lung screening is only available for those with a significant smoking history. With that being said, if you have a primary care physician that has concerns about other areas of your lungs or something else, that doesn't mean that you wouldn't have a chest CT done that might have an incidental finding, but specific lung screening is specifically as of right now for individuals with a smoking history. I am trying to monitor the chat. So, Grace, I really appreciate your thought and input on having social media posts in Spanish as well. I think that that is something I definitely will take to our marketing team to consider and explore. Thank you so much for that.
Thank you, Macy. We'll give it a couple more seconds. Any other questions from the audience for our guest speaker today? And you are more than welcome to come off mute if you would like to ask a question.
Hi, Elizabeth. This is Jennifer again with ECU Health Cancer Care. And as Macy, stated all about lung cancer screening, I will add that just as we do our free mammogram clinics monthly for the uninsured, we also provide free lung cancer screening, low-dose CT clinics monthly for uninsured patients here in Eastern North Carolina that meet the screening criteria. We do have to have a referral from a primary care provider. So if you know someone that has smoked significantly in their life, and either they're still smoking or they've quit within the last 15 years, we can certainly get them signed up for a free low-dose CT lung cancer screening. So one of the things that Macy and I really want to get out is been very diligent about provider education,
Mm-hmm.
but really getting out in the communities and letting people know that there is a screening for lung cancer. Many people know about mammograms. Our mammogram clinic is very well attended. We have a great Hispanic. Most of our patients, I'll be honest, out of 20 mammograms that we did in October, 17 of those were Hispanic patients. So we have screened several Hispanic patients for lung cancer, but we really just want to get that message out that there is a screening for it. Just like, people know that at the age of 40, if I'm a one, I need to get a mammogram. We want people to know about the importance of getting screened for lung cancer through a low-dose CT as well. So just really excited to be a part of this with Macy, and really excited to get my hands on some of those Spanish lung risk assessments, because they really do break it down for folks to really see, hey, this is what I need to get done. And we really want to break that stigma that if you smoke, oh, you did that to yourself and you don't deserve to be screened. But you do, because smoking does not define who a person is. So we really want to get out there and meet those folks and get them screened. And we're looking forward to a great year of outreach all throughout Eastern North Carolina.
Thank you, Jennifer. And I see two hands raised. I'm sorry if I mispronounced. Ciesia Hernandez.
Yes, I am. I just wanted to be clear, to leave things clear in my mind. To get the screening is necessarily to have the referral from the doctor, or just to have the criteria that you described it in this presentation?
So for ECU Health, you do have to have a referral and meet the qualifications that I outlined. There are some resources. So First Health of the Sandhills, they have a lung bus that is fabulous, and they do low-dose CT scans. You do have to meet the qualifications, but I believe you don't have to have a referral. I will, let me pull up their website, and I'm going to drop that in the chat for those of you who might be in the area. But for ECU Health, you do have to have a referral. And Jennifer, would you mind speaking to that process?
Yes, Maddie, and I was going to share that flyer about our free clinic. But if you do meet the screening guidelines, which are ages 50 to 80 years old, and we'll say it again, a 20-pack year of smoking history, either still smoking or quit within the last 15 years, and no signs and symptoms of lung cancer. And we say the no signs and symptoms of lung cancer because if you did have signs and symptoms of lung cancer, such as coughing up bloody or rusty colored sputum, a significant weight loss that you were not trying to attain, those sort of symptoms that are indicative of lung cancer, your doctor wouldn't want you to have a low-dose CT. Your doctor would want you to have a whole different test. They would want you to have a CT with contrast, or possibly a PET scan. So that's why we say that's why one of the guidelines is no signs and symptoms of lung cancer, because if you really were having true signs and symptoms, we would need a diagnostic test, not just a screening test. But yes, if you felt like that you met those criteria that are outlined on the lung risk assessment, your primary care provider would need to refer you to have a low-dose CT. If you have insurance, that's just like getting any other test. If you don't have insurance, they would send the referral to me personally. And the providers And actually, we're going to share the flyer, and I can share a screen and referral form as well. But you would go through me just like you would go through me at ECU Health for a free mammogram. Once your referral came to me, then I would call you and schedule that low dose CT at our monthly free clinic. I know it sounds like a lot of hoops to jump through, but it's really not. You just need to be eligible. And unfortunately, right now, it's just that significant smoking history. I hope that in the future, they will open lung cancer screening up widely for all. As you're probably seeing on the news, I've seen it several times in the last couple of weeks, how lung cancer is affecting more and more people and not necessarily those that smoke. And unfortunately more women. So I'm hoping that legislation will go through that will be able to give everybody a low dose CT at the age of 40, but right now we're not there. So if you have any questions about low dose CT for the uninsured, you can absolutely reach out to me here at ECU Health Cancer Care, and I put my contact information in, but I'll put some more information in the chat.
Thank you so much, Jennifer, for sharing that. And I really appreciate, Sharon, you mentioning your willingness to support us in translations, which would be super helpful. So I will definitely be reaching out. And I saw that Kirsten Ingram had a hand raised. I don't know if she's still available.
I am. Hi, everybody. How are you all doing today?
Great. How are you?
Good. I would be remiss if I did not say, while I came to join the meeting wearing one hat, this topic tugs at a personal heartstring for me. And so as you guys were talking, especially as Jennifer was speaking it, I would be remiss and it would be gross negligence if I did not even share. My stepfather, to your point, Jennifer, we were living in an apartment that was riddled with mold. And I paid out of pocket to have an independent contractor come out to test it. And it was confirmed that it was mold. And you really have to dig deep to know what the housing laws are in your specific county, and what they're going to cover. So a lot of things I covered personally out of pocket, but said that to say I sued them. And the mediator actually was the one that asked the attorneys to leave. And she said, I've never seen a mold case like this before. And she told us, it was four of us, including my dog. The mold actually killed my dog. She told us, I want you all to go get a low dose CT scan. That came from I was not at that time familiar with the cancer space. I was in HIV at the time. But my background, I'm classically trained in public health. So I said, this sounds like something for environmental health, but I really have no idea what they're talking about. Long story short, my stepfather, he was in his 90s. He went to his PCP. He did as they said. He asked for the lung cancer screening. His doctor told him he didn't need it. A few years passed, and he started coughing up blood. He started to have the fatigue. They just kept saying, oh, it's coming with age. Keep doing what you're doing type of thing. Long story short, he ended up passing away. He was diagnosed with stage 4 lung cancer by way of going through the emergency room. And so, one of the things that I found, you have to, I can't say this enough, you have to, if it's borderline ignorant, get in people's face to say, I need this test. Something is not right. If we do not advocate for ourselves, no one else will. He was a well-established patient with this PCP, and he didn't get the test. And so I do hope that they change those guidelines. And it was a travesty that he was diagnosed by getting into the healthcare system by way of the emergency room because he was literally coughing up blood. And so I just thank you all for all the work that you all are doing in the space that you're in. And then, the hat that I came to share to join this meeting outside of sharing that. But that when you said that tugged at a heartstring. You know what I mean? But said that to say, there's a group of a grassroots coalition called the North Carolina Lung Cancer Advocates, and they've been celebrating lung cancer survivors across the state and providing white ribbons. And I'm looking at your screen in particular, Macy, because Paige Humble has presented quite a few of those at a lot of events, primarily through the UNC healthcare system and through Moses Cone. They just had a beautiful one. There were over 114 individuals that were there with well over 48, 49 survivors in attendance. And so just wanted to share with this group if there are any others that would like to share in that celebration of celebrating lung cancer survivorship, to please reach out and we'd be more than happy to link you up with the appropriate person, and in particular looking at Jennifer to see what we can do to make that celebration happen. And thank you, Macy, for the important presentation that you provided and having the materials available in English and Spanish.
Well, thank you so much for sharing your experience. And I am, just so grateful that you are an advocate. And something that, I mentioned, because the qualifications are so specific, something I feel really strongly about is educating individuals and empowering them to be able to advocate for themselves, whether it be with lung health or any other health topic. I think knowledge is power, and being able to give people the confidence to advocate for themselves in their healthcare is really, really important. So thank you so much for touching on that. I'm going to share the file of the English risk assessment tool. I'm going to share that, and then I will also share the Spanish risk assessment tool here in a second. And I want to put up, I know that I saw Elizabeth just drop my contact information in the chat. Thank you. I'm going to pull up my contact as well if anyone needs to take a picture. If you are interested in having physical files of this or educational materials, please reach out to me and I would be happy to share them with you or mail them. Yes, all of the above. So please let me know.
Thank you, Macy. It is 12:02, so I will cut it short. Thank you once again to Macy Mcfarland for coming on today and speaking about the initiative. This will be shared. If you need the recording, or if you know someone that wasn't able to join and needs the recording, please reach out to me to the NCLHA Health Alliance email, and we'll be sure to share this recording with you. And then also, as Macy mentioned, her information's in the chat and will also be shared on the newsletter as well. So we will continue on with last minute updates real quickly. So our last meeting for this year will be December 15th. It will be a little bit earlier just because Mexican's offices do close for break the last 2 weeks of December. So we'll be sharing information on that. And then lastly, we do have a couple meetings coming up in Spanish for anyone who would like to join and learn a little bit more about the needs for what you need to know for divorce, and then also talking about VIH and the resources. Lastly, as many of you know, last week was a pretty hard week for the Latino community. And we did have to cancel a lot of our events, and a lot of our upcoming events, we are putting them on hold just because we want to protect the community. So this flyer is just letting everybody know if, until further notice, all events for Mexican are postponed. And if you have any questions, you can just contact the phone number on the flyer. And then this one is just for any families who need help with the notary. You could just scan the QR code here for a power of attorney. And then also just in case you see any CPBs or ICE around in the area, still just filling out the job form, letting us know so one of our team members can go and check it out. And then lastly, we are looking for volunteers who would like to volunteer. Anybody who has a valid driver's license, a valid NCID, just to keep them safe, and then just having to be a US citizen just for safety reasons as well. These volunteer opportunities is just to be able to help families who are in need of food items or any other items that they may need, that we might be able to go drop them off at their location where they feel safer not having to drive out, and then also any other resources that we can take to them. That's all for our end. Once again, if you are wanting to donate any resources, any donations that you may have for the community, you're more than welcome to email me and we can get in contact for that. I have received a few emails from our Latino Health Alliance members, and I really do appreciate your support. So I will be reaching back out to you. We'll be finishing off lastly with just last minute updates. I know a couple of you did go at the beginning of the meeting, so I just quickly will go down the list. I'm starting off with Ana Velasquez. Any upcoming events that you may have?
Not right now. I mean, everything seems clear over in Durham community. Thank God. I did put my number up there. I do have a driver's license with things that I can volunteer and do for anything, food or anything that's needed.
Thank you. Next, we have Gregorio Cruz. Any events that you may have coming up? You're on mute. I'm sorry. There
Can
you
you
go.
hear me now? Okay.
Yes.
Yes, we will hold a enrollment event for Marketplace and Medicaid. It will be next month, December 13, 9 a.m. at the Advanced Community Health in Raleigh, Rock Quarry Road in Raleigh. People can, if anyone decide to schedule an appointment, because it will be by appointment, can call to me 919-863-1454.
Thank you. Next, we have Julie Gavin. Okay. Next, we have Kathy Garcia.
Yeah, I don't have any information to share. I just hear what you have. Thank you.
Kirsten.
Oops, I'm sorry. I hit the wrong button. Sorry about that. I would say for now, no. One of the things that I was in the process of typing up in the chat, just wanted to make sure that we get the information out about the resources with NC Quitline, as well as ways to connect the community. If there is a need for cessation resources, including vaping and tobacco. And there is a question that's included that we're in discussions about in regards to referrals and what that might look like if there's a cancer screening that someone that calls a quit line might be interested in. So I will connect with the leadership so we can continue that conversation. But thank you all for all that you do. And I authentically wish each and every one of you an amazing week of thanks and gratitude.
Thank you. Next, we have Madison Freeman.
No, I don't have anything right now.
Thank you. Mary Frances.
No.
Okay, and lastly, Sharon Munoz.
Thank you. Yes, I have an event I have a campaign, a blood drive campaign for the next 60 days. It started in November 11 until January 10th. I already shared the flyers in English and Spanish. Each one has how do you register your name? Step number 2, if you are traveling or if you have people in other cities of United States where they can donate. And if you live in Durham, I have 4 events at the streets at South Point Mall. And there is a specific link for that one. And also, if you follow me on Facebook, you're gonna see more details. So I don't want to take the entire time. I put the link also for my Facebook. And this past Friday, it was my very first time that I donate blood. And I share with you, and I was very emotional. And it's an experience that everyone needs to have. Even that I received blood twice, that I was about to die twice. This was my very first time donating, and I want to share that with everyone, that it was an exciting moment, and people need our blood. And today I received the type of blood that I have, and I never liked B plus. I always was an A plus lady, A plus student, but I am a B plus today for blood type. But I encourage everyone to donate. Doesn't matter which part of the country you are, or if you are in Durham, I share the links for everybody to do it. Thank you.
Thank you. I believe that's everyone. If I missed you, you're more than welcome to come off mute. I'll give a couple seconds. I know we've gone way past the time, and it's lunchtime. So with that, I do want to thank everyone, and I hope everyone has a safe week and a great Thanksgiving, and we will see each other again next month. Once again, if you need to reach out to me, you can just email the NC Latino Health Alliance at mexicannc.org, or you can email me personally, and I will put my email in the chat box so you can have that as well. Once again, thank you everyone, and I hope you have a great rest of your Monday.